And there are a few other plants that do it, but it's like we've grown up in harmony with nutritious, high protein, all the omegas. You know, all those things are in the hemp embassy, and why we started the hemp embassy was to try to educate people about the plant, about the history of the plant, and about prohibition. Because really, it's all about money, the war on drugs. If you can corner the market on pain relief, you've possibly got the best business on the planet, is how I see it. Because you know yourself. If you've got pain, you've got a friend with pain, you find the right medicine that takes that pain away, they'll sell the shirt off their back to you. And the pharmaceutical industry knows that well. When you go doctor's training now, you learn all about physiology, but basically you only learn this is the pill to take to deal with that disease. And the rest is passed over to big pharma's laboratories. Whereas in nature, we have a massive history, all the plants have a use, and cannabis is an extraordinary plant. Basically, I think it's its anti-inflammatory properties. And for my layman's understanding, most pain is swelling, is inflammation. So I think that's the secret with cannabis. And I think it's even the secret mentally for us people who love it, because you kind of let go a bit, you surrender a bit. It's a female plant. We don't smoke the males, we pull them out. So it's a victory for the women, which has been great to see happening in the last few weeks. We are definitely not Parliament House in Brisbane. Anyway, I want to, Dr. John Teh, introduce you to Dr. John, who I've known for a couple of years, and he's actually a pretty local fellow in the Tweed Valley, but he started the Plantmed clinic in Brisbane, and it's been a huge success. And for me, he pretty much gives the best presentation to introduce you to the plant and give you a bit of an idea what it's about. And I mean, we've all learned. I discovered that cannabis stopped me getting migraines. You know, I discovered Nimbin has got quite a few epileptics who don't have seizures because they smoke pot all the time. The village is full of alcoholics who don't drink because they smoke pot instead. Possibly it's the best herb drug on the planet for getting off other addictions. So the hemp embassy, we've got people working there who were alcoholics, who were ice addicts, who were heroin addicts, and now they smoke pot. So it's interesting. So I don't want to waste your time anymore, but there's quite a few people here from Nimbin who smoke pot for a long time. You're welcome to talk to any of us. You're welcome to go to the hemp embassy at any time. Dr. John will talk for an hour or so. Then Dr. Jamie Ricord, who's there, standing there, will talk for an hour or so. Then we'll have a break. Then David Holburn, ex-magistrate local, that's him there, on cue. He will talk for an hour or so. And then we'll have a Q&A on stage up here with everyone. So you'll all get a chance to ask all your questions. Please don't be shy about it. And many thanks for coming. The toilets, you go to the far corner out there where there'll be a great lunch on. You go to the far corner, you walk down a long ramp and then at the back up there. So just go to that corner and then down a long ramp back towards the street. And this is Disco's sister. She's basically in charge, really, not me.
Hello.
And this is Dr. John. Thanks heaps for coming.
Over to you.
Thank you, thank you. Good morning everyone, and thanks for coming down to Nimbin today to learn about this amazing medicine. So first of all, let me introduce myself. I'm Dr. John Teh. I run a cannabis medicine practice in Brisbane. I'm currently treating people every day with cannabis medicines. I've been in this space since legalisation began back in 2016. So at the clinic we've done over 3,000 patients now. Currently got that many on our books. And when Disco's sister comes back we'll change the slide. But I'll just talk on a little bit. So I'm just going to assume everybody here, there'll be a lot of different levels of knowledge. So I'm just going to start from the beginning and start from the basics about cannabis medicine. And the basics are, of course, THC and CBD. So the main cannabinoid is definitely THC. THC, or tetrahydrocannabinol, is the part of cannabis which people smoke for fun. It's the part that gives recreation. It's the part that makes you feel happy. So it's the part everyone knows about, that we associate with the hippies from the 60s. The other part which is a very important part of cannabis medicine, is CBD. So it's the second most prominent cannabinoid in the plant, and its name is cannabidiol. Now, CBD, if you take it, you won't notice anything straight away. It doesn't have any high or psychoactive effects, so it's completely different to THC. It's a completely different shape, and it works in a different way. CBD, next slide please, sister. CBD is, next slide thanks, is a great anti-inflammatory molecule. So when we take it, it works to reduce inflammation throughout our body, and it's a great anxiolytic molecule. And importantly, anxiolytic meaning reducing anxiety, and CBD also helps to balance out THC in our bodies. If we take too much THC by itself, we can actually get a little anxious, or we suffer from side effects of cannabis, which are fairly minimal, and I'll get into those soon. So THC is an amazing molecule, and what it does is it goes into our body and it mimics a natural molecule that our bodies make. So in our body, we have a thing called the endocannabinoid system. What that means is inside cannabis system. So we've always had this system. Every animal on the planet has this system as part of its basic makeup. And what we do all day, every day, is we secrete our own natural cannabis in our bodies to regulate all of the other functions. And when I say all of the other functions, I mean all of the other functions. So that implies pain regulation, that implies sleep-wake cycles, that implies gastric motility, that implies menstruation, and that implies aging. That implies every system in our body. That implies inflammation. That implies immune response. So that's why if you look at this slide, and I know it's a little small, but don't worry about the pictures too much. I'll be talking about them anyway. There's lots of effects of THC in our body. The one effect that we use most commonly, I suppose, in medical practice would be for pain. And I'm sure, hands up anyone in this room who's got pain in their body. Right. So that's about right. Over 50% of patients will come in for pain. Okay? So THC is the main molecule that gets rid of pain. CBD will help with pain, but only from an anti-inflammatory effect. So it's a great pain reliever or analgesic. THC is an antiemetic, which means it helps reduce nausea and vomiting. So that's why we always think of cancer patients using THC to help with their symptoms, or cannabis to help with their symptoms. It's the THC molecule that really does that. So if we were to give CBD to a cancer patient, they probably wouldn't get any nausea relief from that medication. THC is also an anti-inflammatory. It's an antipruritic, or helps stop itching. So for skin diseases like psoriasis and eczema, it's a great thing, topically or orally. THC, interestingly, is a bronchodilator. So everyone obviously associates smoking with cannabis. In the medical field, we never promote smoking. Not that cannabis smoke is carcinogenic. There's no studies that say that there's an increased chance of cancer from smoking cannabis, but it can be irritant to your lungs. It is smoke, and it is particulate matter. So we don't recommend smoking, we recommend vaporization. And vaporization is a method of inhaling cannabis without burning it. You essentially heat it up, so you boil off all the important elements in there and inhale them into your body. So it's much healthier. So when you use that way, THC can be used as a bronchodilator. So I've actually got patients who are asthmatic or have COPD or chronic airways disease, where we actually use tiny amounts, less than psychoactive, so not enough to get someone high, to actually assist with their breathing. So by inhaling this small amount of THC, they get a bronchodilation effect of their lungs and they can breathe easier, so kind of like their asthma puffer. So it's never something that I would recommend that you would only use for your asthma. You would definitely want to have your puffers and other sort of things as well, but it can be used in that way. THC is a great muscle relaxant. It's a great relaxant throughout our whole body. So not only our skeletal muscles, our voluntary muscles, we all feel tension in our necks when we're stressed, and THC will help relieve that muscular tension. But not only those muscles, all of our muscles. So our blood vessels, if we've got hypertension, THC will actually dilate your blood vessels a little bit too. that can be used in that way, but once again, we wouldn't rely on that if you had long-term high blood pressure. But you have to watch out for it. And also, THC is a great antioxidant. It's been shown to be a neuroprotectant, so to protect the brain against damage moving forward as we age. One important thing to know about cannabis medicines is they are just very, very, very safe. CBD, there's really no side effects to it. At high dose, there are some liver interactions which your doctor or your health provider should let you know about and monitor for you. But CBD, essentially, you can eat it by the spoonful and you're not going to have any negative health consequences. You're not going to die. THC, we have to be a little more careful with, but once again, you can never die from a THC overdose. You may feel very uncomfortable if you have too much THC without letting your body get used to it. You may feel anxious or even paranoid, but it's impossible to kill yourself or stop yourself from breathing by ingesting any amount of THC. So THC is a much more potent molecule, so we handle it with more care, but you can't die from cannabis medications. Next slide, please, sister. Let's skip through that one as well. So, and that one, thanks. So THC works throughout our body with many, many different ways. And the dosing we use, it's very variable. It depends on what your symptoms are, how bad they are, how your body responds to that medicine, other factors, what other medications you're taking as well. So the dosing of THC may be as low as 1 milligram and people can get an effect. It may be as high as 100 milligrams or more for that particular patient. So the dosing range is very wide. Generally, most patients that come to our clinic are what are called cannabis naive, or haven't smoked cannabis or tried cannabis ever. And generally we don't say, here's a joint, go and smoke that. They'll be reckless. We usually start with oral oil medications because we can judge the dose very accurately. So if we say you take 0.1 of a milliliter of this oil twice a day, and I know that's 1 milligram, okay, so it can be accurately judged. That's an important thing. Oral oils are a much smoother way to introduce cannabis to the body. When you take cannabis orally, you get a nice smooth shape, kind of like this, over 8 hours. It takes about an hour to start, and then it slowly builds, and then slowly tails off. So if we do 2 or possibly 3 doses per day with an oral oil, CBD and THC, then we'll cover the symptoms for the whole day. If you smoke or vaporise and inhale cannabis, which is another method, then you'll get an immediately large peak of THC and CBD in your blood. And that's instantaneous, within 5 minutes. And then that'll then tail off over 2 to 4 hours. So the psychoactive effect, or the way it makes your head feel, the high feeling, can be a lot stronger when you're using inhaled cannabis. So if you are a person that hasn't tried cannabis before, it's probably not a good idea to jump straight into the most strong and potent cannabis flower you can find, but rather ease your way in with a THC oil which is balanced with CBD. Next slide, thanks sister. Next, thanks. So that brings us to CBD. That's the CBD molecule. It is very similar to the THC molecule, but it differs in enough ways that it won't actually bind directly into our cannabis receptors. Next slide, please. So CBD, as I said, has no high effect. And it's a very, very important molecule to include in cannabis when you're using it as a medication. If you're perhaps using THC recreationally, you may not want to use CBD, not from a health perspective, but as a personal choice, because one of the main things that CBD does in the medical sense is reduce that psychoactive or high feeling. Now, a lot of people will find that feeling a little uncomfortable initially, especially if there's no CBD involved. So I make sure in my practice that all patients have adequate CBD in their treatment regime, and that will reduce anxiety, just generally, but also reduce anxiety that may be associated with the THC dosing. So CBD is an anticonvulsant, And it's the big medication which we all have seen on television in regards to epilepsy. And childhood epilepsy is obviously a big thing we see on television because it tugs at our heartstrings. CBD is an excellent anticonvulsant. It's not as potent a molecule as THC, so with CBD we often need higher dosings. So for instance, THC we may dose somewhere between 1 and 20 milligrams twice a day, roughly. Whereas with CBD, I would probably start at about 20 to 30 milligrams twice a day and then increase from there. And in the case of epilepsy or seizure disorders of all kinds, the amount of CBD is often a lot higher. So up to 15 milligrams a kilogram is what the studies say, but that's actually a fair bit if you do the maths. But often over 200 milligrams a day of CBD will be a common thing. And for severe epilepsy, I've got patients on up to 400 plus milligrams a day. Now that is very expensive, but saying that, I've had excellent results in epilepsy patients. So one particular one that springs to mind had been having seizures for her whole life, since she was a teenage girl, and she came to me probably aged about 50 years old. And from having 35 plus seizures a day, we've now got her on a fine balance where she will rarely have a seizure, and she's had periods of 6 to 8 months seizure free, which to her is an amazing thing. But that was through a lot of diligence and a lot of high dose CBD, as well as a little bit of THC put in there as well. So I think when you're dealing with those sort of elements, it is very important to go and get a medical professional to help you. When you're using CBD doses that high, even though there's no side effects to CBD and it's completely safe, there are some things we need to look out with, especially the way other medications may be broken down by your liver. Because high doses of CBD like that can actually slow down some of the enzyme in your liver, and particularly in the case of epilepsy, a lot of the seizure medications may not be broken down as quick as we might expect, and their levels may rise. So I would always recommend, if that is something, seizures is a problem for you, to go and get some expert advice and look into that. So that's the first two there. CBD is an analgesic, but really only from its anti-inflammatory effect. So if you've got proper strong pain, like back pain from nerve root compression, CBD is probably not going to do the trick for you. CBD alone will probably do the trick in terms of anxiety or mood disorders. CBD has an antiemetic and anti-nausea effect, but not really as strong as the THC. And once again, it's neuroprotective. So there's a lot of work being done looking at CBD, and we can see signs of damage to the brain and certain chemicals in the brain which will be elevated when we age and we get deterioration of the brain. CBD is shown to be a neuroprotective agent. So taking it, even if you're not sick, can be a good idea, like a supplementation, to protect that brain against aging. And we all age. So it helps reduce the oxidative signs of damage in our brain. Next slide, please. I'll skip through that one as well. So I'm not going to go through all of these slides because some of them are aimed at a different audience. So I'll skip through that one as well, and skip through that one as well, and that one as well. So dosing of CBD. As I mentioned there, dosing for CBD usually requires a lot more milligrams of medication. Skip through that one, thank you. And we'll skip on there. So, decarboxylation. So when we smoke cannabis, it heats up, and that activates it. That's called decarboxylation. So we're actually losing an acid molecule off the side of the THC. So if you have a fresh plant of strong cannabis, and you juice that plant and it's full of THC molecules, it'll be in a form called a raw form of THC, called THCA, and that A stands for the acid bit. So this little diagram is just saying when you heat up cannabis, you lose that A, or the acid bit, and that changes the shape slightly. So if you ate that whole raw plant of cannabis, you wouldn't get high at all, even if it had thousands of milligrams of THC in there. But if you got that plant and put it in the oven for a little while at 60 or 70 degrees, or you smoked it and added heat, that would then take off that A molecule, the acid, and that will make it active. So we call that decarboxylated. So then the molecule can go into our bodies and bind onto our cannabis receptors, and then we can get that pain relief effect, we can get the high effect or the euphoric effect. All the effects of cannabis medicine are generally more pronounced when we heat those products. So in the medical area where I work, generally all of the medications that we have are decarboxylated, meaning they're activated. Next one, thank you. And let's just say we need to add fire or heat to our medicine. So generally all the medicines you'll receive from, if you came to see me, would be decarboxylated unless you're getting the dry flower, in which case we would heat it when we used it. Next one, thank you. So there's many different types of cannabis in the world, and strain is a controversial word. The correct word we should use is chemobar. So a chemobar of a plant, any plant, is the type of plant. So if we're talking about tomatoes, we would have your Rouge de Marmande, we would have your Tom Thumbs, we would have your Tiger Greens, we would have your purple tomatoes, and we'd have your yellow tomatoes, and we have your cherry tomatoes. They're all chemobars or strains of tomatoes. In the world, because this plant has been so popular for so long, gardeners and growers have been breeding a myriad of chemobars of strains of cannabis. And that's to our advantage in the medical cannabis field, because every different plant has a whole suite of molecules in it. And I'll get off my slide topic, so we'll probably come to it later, but I'll talk about it now while I'm talking about it. THC and CBD, they're the main cannabinoids, they're the main active ingredients in the plant. But there's over 144 other different cannabinoids, and probably more by now, that have been discovered in the plant, or potentially in any cannabis plant. There's not only THC and CBD, there's CBV and CBN and CBG, lots of different different types of cannabinoids, okay? And they all have effects in our body as well. Not only that, the thing that gives cannabis a smell are things called terpenes. Now these give all flowers their smells, and there's over 400 potential terpenes found in the cannabis plant. So they work with the THC and the CBD in our body. They work in our bodies as active molecules. So you might know terpenes by their common names. Lavender oil. Everyone knows that if they sniff lavender oil or rub it behind their ears or under their nose, you get a calming feeling. And that's because the main terpene in lavender is called linalool. And that has a calming and anxiety relieving effect on our bodies. And in fact, linalool is often found in cannabis plants, in the medicines that are calming in nature. And then we have a whole suite of these different terpenes. There's over 400 found in the cannabis plant, and they work together with the THC and the CBD and the other 142 other cannabinoids in the plant. And that's called the entourage effect. So what that means is, it's not just the CBD, it's not just the THC, but the whole suite of the molecules in the plant that we need to consider. And they work together. So when we use those medicines, maybe your brother would use a medicine and get a great effect on his pain, but you may use that medicine and only get a mediocre effect. And that's because of the difference in your natural cannabis system and the terpenes and different molecules in those cannabis medications. So that entourage effect is so important. And in Nimbin, at the Hemp Embassy, I know they're very big fans of what's called whole plant medicine. So whole plant medicine means we don't just take the CBD out of the plant, and we don't just take the THC out of the plant, but we extract all of the molecules that are in that plant and include them in the medicine. And that's what gives us different strengths of medicine. I'll get to that in a second. But we need all of those molecules as the main thing. If we just take out the CBD or just the THC, which we can do in the lab, and extract just those molecules, studies have been done showing that isolated THC and CBD are not as effective at relieving people's clinical symptoms as these whole plant medicines or full spectrum medicines. So we always want to choose those full spectrum medicines where possible. There is a place for isolated cannabinoid medicines. And for some people that have, jobs where they definitely can't use any THC because they won't have that job anymore, that would be one of the instances where I would use that isolated medicine. But generally, we always want whole plant medicines, and I know that at the Hemp Embassy they only have whole plant medicines, and at my clinic we only have whole plant medicines except for a few small exceptions. And there's two main types of chemovars. That brings me back to the chemovars again. There's two main types of cannabis. So then there's thousands and thousands of strains or chemovars, but there's two main types that we need to consider when we're using them as medicine. Sativa and indica. So if we skip to the next slide, please, Esther. The majority of medications that we use as medicine are often indicas. Indicas are types of plants that are shorter, have fatter flowers, have shorter leaves. So that's how we tell morphologically what the plant looks like. But they have different effects in our body generally. So indica-based medications will be sleepy. They'll be more muscle relaxing. They're usually more of a bodily feeling, so very good for pain. They're an appetite stimulator. So they're softening medications, you could say. The other main type of medication is sativa-based medications. So sativas, although they're still cannabis plants, have different effects. Sativa-based plants are taller, usually grow outside, have skinnier leaves. But the main difference is sativa-based plants will energise you, will keep you awake. They're more of a feeling in your head rather than the body. You may have more creativity, so it may be something where you would be able to, say, use it if you're being active for gardening or if you're an artist for creating. But you wouldn't want to take those as a medication at night time because they'll keep you awake all night. And that has happened to people in my practice for sure, where they've accidentally got those two types of medication mixed up. And they've used a sativa-based medication and they say, "Doctor, I can't sleep, I haven't been able to sleep for a week." Well, oh, that's very strange because you were sleeping great last week. And it was simply because this particular person had got those two little tubs mixed up and had used the sativa-based medication at night time instead of the indica-based. Next slide, thanks. So it's something to be aware of, and another reason why, if you are inexperienced, where you should get some guidance in your treatment. Next slide, thank you. Next one, thank you. That's the entourage effect which we were talking about before, and that's just saying that all those molecules in the plant are very important. Next slide, thank you. And this is the slide that I was talking about before, once again, talking about all the different elements of active ingredients that are in the cannabis plant. Next slide, thanks. And this is a slide indicating just a few of the minor cannabinoids that are very relevant. And there's an interesting one there, THCV, or tetrahydrocannabidiol. And it's an interesting minor cannabinoid which I've been looking at recently because I've had a few patients with diabetes. And that molecule has actually been shown to help reduce blood sugars. So if you've got a cannabis medicine which has that type of minor cannabinoid in it, it may help reduce your blood sugars and relieve you a bit of your insulin or your other oral anti-glycemic medications.
Dr. Teh,
Yes.
brief question.
Yes.
Can you prescribe that? Knowingly prescribe that?
You can knowingly prescribe that if you have the knowledge of the strain breakdown. So when we get medications presented to us as doctors, I always ask the producer for a breakdown of the cannabinoids and the terpenes. Some people have that available, some don't. And in some strains of medication, you can see that it is there. And so I would make that choice clinically. And that would depend on so many things, but availability and yes, in a way you can. Okay. Next slide, please. And this is just an image indicating those terpenes that I was talking about. One of my favourite terpenes is the one in the middle. It's called beta-caryophyllene, and it's also found in black pepper, and it's an amazing terpene because it actually comes into our body and it's a great anti-inflammatory. It goes into our body and it binds to the cannabis 2 receptors, which are all the types of cannabis receptors which are found on our immune cells and our inflammatory cells. So that particular terpene is found in a lot of the pain-relieving strains of medication, some of your heavier indicas, such as your Kush strains and that sort of thing. But it binds onto those receptors and it makes those receptors, those cannabis receptors, stronger at holding on to THC and stronger at holding on to your natural cannabinoids, and will down-regulate inflammation in our body. So I always use that as a little add-on terpene which I can give to patients as an oral drop once a day, or massage into the skin, and that will help pain relief. It helps bring about pain relief. It's on its own. And my little daughter's here today, and when she was having her teeth come through, I used to rub that terpene on her gums, and 10 minutes later the crying would stop. So that proved to me that that really did work, especially when I got some sleep. So next slide, thank you. So this comes, now I'm just going to briefly talk about the endocannabinoid system. I'm not going to get into specifics today about how we treat this medication, how this problem or that problem. That'll come up when we do question and answer time. So I want to talk to you about this endocannabinoid system now. So next slide, thanks. So cannabis has been a medicine which our bodies have utilised since the dawn of time. In 1964, the cannabis molecule was actually isolated by Professor Dr. Mahoulan. But this medicine has been present in our bodies forever. Next slide, thanks. And as we've evolved with cannabis, it's evolved with us as well. So in our bodies we have a natural cannabis system. It's called the endocannabinoid system. And all that means is inside cannabis system. And we produce endocannabinoids, inside cannabinoids. The main one being anandamide, and there's a picture of anandamide there next to that man jumping in the air. And that comes from the Sanskrit word meaning bliss. So that's the molecule which THC mimics. So anandamide is essentially our THC in our body. And that's why THC makes us feel happy. When we are regulating our body, we secrete natural endocannabinoids all day, every day. You're doing it right now. The other main cannabinoid is endocannabinoid is 2-AG or 2-arachidonyl glycerol. So next slide, please. So we secrete these molecules all the time to regulate everything in our body, and they're made on demand when we need them, and they then go and stick to the cannabis receptor, and those cannabis receptors are variably expressed. It means they're not always there. They might be on that cell one day, but they might hide away again and be popped out again later on. So it depends on where your body needs assistance in any of its metabolic regulation. We will express cannabis receptors. We will then secrete our own cannabinoids. They will stimulate those receptors and make the change required. So for instance, if you had a sore knee from arthritis, around that knee you'd have lots of white blood cells that are trying to fix up that inflammation and causing inflammation at the same time. And the general that organises that army is your endocannabinoid system. Similarly, if you had insomnia and you had troubles with your sleep-wake cycles, which is to do with your melatonin and other neurotransmitters being released at the right times, we might find that those particular areas of the brain will express cannabis receptors because they're waiting to be stimulated so that they can make your melatonin for you. So once again, the endocannabinoid system's in control. When you are an epileptic patient, we have cannabis receptors all throughout our central nervous system. Next slide, thanks. And that's one of the main locations they're found. And when we have, next slide, thanks, epilepsy, for instance, normally we'll trigger a neuron in our back of our brain that may go through to make us move our arm, or we see a light, a neuron gets triggered, and that will go along. But sometimes if you're an epileptic, that transmission of electrical impulses won't stop. It'll get bigger and bigger and bigger until it turns into a seizure. Now, in us at all times, our cannabis receptors will be expressed, turned on, will secrete a quick bit of endocannabinoid and turn down that electrical signal. In the epileptic patient, that doesn't happen and you end up with a seizure. So you're looking in the brains of the epileptic patients, you'll see lots of cannabis receptors being expressed in the areas of their epilepsy. In Parkinson's, it's a movement disorder that's based around the centre of your part of some of the structures in the centre of your brain called the basal ganglia and substantia nigra. And that's where we secrete dopamine. And dopamine is important in not having tremors and good muscle and voluntary muscle control. So if we radio label cannabis receptors, we see there's excess receptors all around this area of the brain saying that bit wants stimulation, but for some reason it's not getting the stimulation, and that's where cannabis medicines will come in. So this is a quote from, no, I won't worry about that quote. Basically, it's the balance system of our body. It's homeostasis, or a fancy word for balance. It keeps our body in balance. When we're too hot, we'll express cannabis receptors in our sweat glands to turn on our sweat ducts so that we sweat and we cool down, and then they'll be taken away when we turn that off again. So our body is intelligent and responds to needs where it needs to be responded to. Next page, thanks. And cannabinoids are present from birth. They're present from conception. So endocannabinoid system guides the growth of our body. It's one of the most prominent, and it's at highest levels expressed in breast milk. So there's the endocannabinoids are extremely important in association with the supple response and mother-child bonding, and father-child bonding for that matter. Next slide, thanks. So they're in all of us from the very beginning. And this is just indicating, yes, literally from the cannabis receptors have been found from the second day of gestation in mouse embryos. So as soon as you've created, this system starts developing itself and guiding its own direction, and then guiding the direction of your body's growth as well. Next page, thanks. Next one, thanks. That's just Professor Mahoulam. He's an Israeli professor who discovered the cannabinoid molecule, so people consider him the grandfather of THC. He's still alive. He's about 80-something now, and he's actually joining in and talking at video link at a cannabis conference that's happening this year on United in Compassion up in the Sunshine Coast. So he's still around, and we owe him a lot for finding this molecule. And he is one of, that discovery has then led on to us discovering the endocannabinoid system about a decade later. Next slide, thanks. And that's just a complicated picture explaining the actual chemistry of how cannabis receptors are stimulated, how endocannabinoids are generated, and how they work at the cellular level. We don't need to know about that today, but we do know how it works. This is a real and amazing medicine, and we do know how it works. Next page, thanks. Next page, thanks. So this is just a graphic indicating the two main areas of our cannabis system. Centrally located in the brain and spine, peripherally located, associated mainly with inflammation and immune response. Next slide, thanks. And next slide, thanks. We'll just skip through a second until we get the pictures. One more, thanks, sister. One more, thanks, sister. So this is a radio labelled image showing cannabis receptors in a person's body. And so you can see mainly in the brain, mainly in the central nervous system, all your major organs, your reproductive organs, and then less dense peripherally, but still present. Very important in all your inflammation and immune response. Next page, thank you. And this is just another slide indicating all those areas in our body where we find cannabis receptors, and it really is just all of our organs and all of our body. So in the brain, we've got associations with sleep and learning, memory, neuroprotection, neural development, pain, appetite regulation. In the lungs, we've got that bronchodilator effect I talked about before, liver healing, bone remodeling, muscle fibre formation and control, cardiovascular dilation and blood pressure control, cardiac function, immune function in the spleen, insulin secretion in the pancreas, the guts, gastric motility, how your intestines actually move, and also a very important inflammatory and immune response component in our reproductive organs, and very prominent in our immune system. So it's an integral system. It's the top system of our body, and I'm just so glad that we finally found a medicine that is safe, that we can stimulate this with effectively. Next slide, thank you. again, just indicating this system is everywhere. Next slide, thanks. Next one, thanks. So this is a picture of our brain, and in the middle there is that little area I was talking about in regards to dopamine and Parkinson's. And throughout there's all these important areas of our brain where it's loaded with cannabis receptors. There's more cannabis receptors in the brain than there are receptors for any other neurotransmitter. That includes opioids, that includes acetylcholine, that includes everything, adrenaline, noradrenaline, dopamine. And importantly, there's a lot of receptors found in that central area, and that's our old brain. That's our reptile brain, people call it. So that's why cannabis is great as an emotional regulator. It's great for anxiety, because that's the part of the brain that's all associated with the fight and flight response, survival, emotion, anger, learning, memory, good memories, bad memories. So that's why THC is so useful in treating all of these different mental and neurological conditions. Why it's good for anxiety, why it's good for depression, why it's good for tremors, why it's good for seizures, why it's good for PTSD and emotional things and imprints. So in PTSD, what happens is you have a thought on the outside of your brain, the curly bit there, the cerebral cortex. That's your conscious mind, and you think about that thing that happened in the war. And then what would normally happen is you'd be like, oh, that was a bad time, and get on with your life. But if you've got PTSD, what happens is you have that thought, you get a little trigger, a little signal that goes down to that middle part of your brain and turns on your emotional and physiological responses to that thought. So then your heart rate increases, you get adrenaline release, you get cortisol release, you essentially get fear. You've got to get up and run or fight that enemy. So that's PTSD. And the exact mechanism of how PTSD is assisted by cannabis is not completely worked out yet. But we do know there's a change in that connection between that thought bit and the deep bit. So after effective cannabinoid therapy for PTSD, that patient will have the thought about that time in the war, but they won't have the heart rate, they won't get the panic, they won't get the fear. So then, it's not PTSD anymore, it's just a bad memory. Next slide, thanks. And that's just another one of the same. Next slide, thanks. So this is why I was mentioning before cannabis is so safe. This is a picture of the brain, and that little bit at the bottom is the brain stem. And that's the bit of our brain, that's the very deep bit of our brain, the very reptile bit of our brain, which all it's concerned with is keeping our heart going and our breathing going. That's all that little bit there called the pons is really about. And although I've been, bigging up cannabis and its cannabis receptors throughout our body, the one place where they're really absent is in that little lump, in that pons. And that's a great thing, because that means no matter how much cannabis you have, you can't suppress your breathing and your heart rate with it. You can't turn off your heart and your breathing like you can with opiates. And that's a really big problem in our country and the Western world, is we've been using these opiates. Yeah, they're great for pain, don't get me wrong there, but there's a lot of other negatives about that. And one of the negatives about opiates is if you have too much, you affect that little centre there and you turn off your breathing and you just stop breathing. So cannabis medicine is so safe that you can't turn off that area, you can't hurt yourself. And in fact, next slide. And in fact, there's an effect called the opioid sparing effect, which we utilise in cannabis medicine. So what happens is if you have opiates in your body, so morphine or endone or tramadol or Panadine Forte, you get a certain amount of pain relief. If you have just used cannabis medicine, CBD and THC, you'll get a certain amount of pain relief. But when we put them both in your body together, we get a much greater nociceptive or pain-relieving effect in our bodies. And that's called the opioid sparing effect. So on the ground, what that means is we need to reduce opioids very often or remove opioids from a patient's treatment once we get them up to adequate dosing on their cannabinoid medications. So that has amazing health implications in the number of people that don't die from overdoses of opioids in our society. The side effects of opioids can be quite intolerable. Like people say they feel like a zombie. They just have no heed for life anymore. They often give terrible constipation and make people feel nauseous or just generally not feel very well. So if we can reduce or remove those medications from a patient, they're much happier in a much better spot. Next slide, thanks. Next one, thanks. So this is just a slide, and I won't go deeply into it, indicating how CBD works in our body. So although CBD doesn't directly stimulate our body like THC does, it is very important. CBD, in very general terms, supports our endocannabinoid system, or our natural cannabis system. It makes it healthier. It increases the strength of the binding efficacy, it's called, but the strength of the fingers, and especially the cannabis 2 receptors, just like my favourite terpene, caryophyllene, does. So what that means is that it has increased regulatory effect on the inflammation and immune system. So that's why, one of the main reasons why CBD is a great anti-inflammatory molecule. And it's just as good as Nurofen or ibuprofen or any other pharmaceutical anti-inflammatories we use these days, without the side effects of gastric ulceration and sore tummies. But not only that, CBD affects many other areas of our endocannabinoid system. One other main point I'll let you know about is the way that CBD will slow down the action of an enzyme called FAAH, which is the enzyme responsible for breaking down our natural cannabinoids, our anandamide. So that means that CBD will boost your natural cannabinoid levels as well. That means you're going to need less cannabis medicine from the outside and you're going to feel better. You're going to have relief from some of your symptoms just from CBD alone, and then we add in THC to get an even better effect. Next slide, thanks. So the endocannabinoid system is spread throughout our body. Its main function is balance, and it's the system which we can utilise by adding cannabinoid medicines into our body. And those cannabinoid medicines are simply mimicking our own natural molecules in our bodies. That's why this is a natural medicine. One thing I always say to patients is cannabis medicines are health positive. So there's even the side effects of cannabis. The side effects of cannabis are fairly minor. Not really any to do with CBD. THC, you can get some small amount of anxiety or paranoia if you have too much THC without any CBD. You can get a slight increased heart rate or decreased heart rate from cannabinoids. You can get a slight decrease in blood pressure, or less commonly increase in blood pressure from cannabinoids. You may feel a little tired. We can use that to clinical effect if you have got sleep problems with cannabinoids. You can have some motor coordination issues, so be a little wobbly on the feet or a little slow in reaction. But minor things. The side effects of cannabis are minor things. Things that will leave as the medicine leaves your body and your liver breaks it down and we excrete it over 6 to 8 hours. And things that your body will tolerate to over time. So they may be slightly annoying, frustrating initially, but often as we continue to take cannabinoid medicines, we will lose those side effects annoying us and we won't notice them anymore. So the side effects of cannabis don't hurt you, is what I'm saying. So the side effects of the majority of pharmaceutical medications, they can have negative effects physically on our body, like our livers. If we take too much Panadol, we can fail our livers, we can make it fail. Most medications have side effects. Chemotherapy agents have extremely toxic side effects on our bodies. They're health negative side effects. Cannabis is a health positive molecule, a health positive plant. So we can use it without fear that we're hurting our bodies. In fact, we're doing them good. And there's a lot of nuance to cannabis medicine, and that's why I think it is a good idea to come to some people with experience, to come and educate yourself like this, to talk to the people at the Hemp Embassy who are very experienced with helping people with their treatment choices, to come to a doctor like myself or Jamie or any of the other forward-thinking medical practitioners in this country so that you can get a good, effective, safe treatment. So cannabis medicine is safe, cannabis medicine is effective, and it works on our body's natural cannabis system. So I might, if I'm not sure how we're going for time, I won't bother using any more slides. The main points I wanted to let everyone know here are that cannabis is safe. Cannabis is effective for many, many different conditions, and that's been proven in many clinical practices such as my own and through the effect on people who have used these medicines. It's part of our natural body and our natural evolution to use these medicines and to evolve with them. And it's not just about, when we use cannabis medicines, an important thing is consistency. So I think there is a difference. This is one of those arguments you could have with people in the cannabis and medical cannabis space, whether cannabis recreationally used and cannabis medically used is the same thing. And there's arguments for both ways of looking at that. You know, recreational use often is self-medication, but recreational use might be just recreational as well. And I feel that the difference in that is a consistency of dosing or cannabinoid application in a consistent way, aiming to support the endocannabinoid system. So you take these medications every day like you would take any other medication. You wouldn't take a medication for your depression only when you're depressed, for instance. You would take it consistently. And cannabis medicine is the same. Although we can treat symptomatically, if you are in pain, yes, a vaporizer of high THC cannabinoids will help you with your pain, but we can prevent that pain. We can prevent that pain by pre-dosing with our cannabinoids and therefore supporting our natural cannabis system and supporting our own natural level of production. And an interesting thing which I didn't mention to you is that THC itself is an endocannabinoid system upregulator. Okay, what that means is if you take a little bit of THC, it increases the effectiveness of your body's natural cannabis system at using THC. So it's a self-fulfilling prophecy. It's helping you out. CBD is naturally supporting the endocannabinoid system all the time. So, and I know Dr. Jamie is going to talk to you a little bit about this, and he and I are very similar in thought that we have to support this endocannabinoid system to make it as healthy as possible, and that's the basis of your health, that's the basis of your healing. So, if I've got time, I can take a couple of questions. So yeah, an excellent medicine, and I'm happy to take some questions now, and this will bring out a few more things that people want to know about.
Yes.
Thank you.
That was great. Thank you so much. So do we have a supply and prescription medicine in Australia yet?
Yes, we definitely do. The question was, do we have supplyable prescription cannabis in Australia yet? And the answer is 100% yes. Since late 2016, doctors have been able to prescribe cannabis, and at that point there was, limit in how much was available in the country and supply issues. But now there's multiple companies. There's at least 4 or 5 active growers in Australia now. Some of them are just coming to market. Some have been in market for 6 months. There's a lot of suppliers importing still from Canada and other legal areas where cannabis is medically legalised or fully legalised. So there's a lot of medicine in the country at the moment. And in fact, I think at the moment, with the natural growth cycle of cannabis, there's a bit of a lack of illicit cannabis around at the moment. And I've seen a lot of self-medicating patients coming over to the clinics as price point drops and availability on illicit market is reduced. So there's very good supply at the moment of high quality cannabis medications in Australia, yes.
Next question. Yeah, great presentation, Dr. Teh. Really appreciate it.
No problem.
Yeah, a lot of questions there came up to me to talk, and I'm trying to remember a couple of them. The first one would be, for people who have had, say, like splenectomies or tonsillectomies, to what extent is the endocannabinoid system compromised?
So, your endocannabinoid system itself will be compromised because those are major immune areas and there's a lot of cannabis receptors in there and a lot of communication that occurs in those areas. The main thing you're going to get in those sort of things, splenectomies especially, is decreased immunity, decreased immune response. So it won't be a lack of endocannabinoids or in the endocannabinoid system, but a lack of a major organ which produces your immune system essentially. So you're going to have a lot of lower immune response, and you're going to get more infections and have less immune response to things, so less defence against the outside world. So that's a very sort of specific thing. It wouldn't be a detriment necessarily of the endocannabinoid system, but a large organ that's going to have an effect there.
All right, there's a gentleman here. I don't know if the light will reach, but let's have a look. I'm wearing a mask and staying close.
G'day, John. Good to see you.
G'day. Good to see you, Mike.
I've got a couple of questions. One, I've got a bit of PTSD, and I've been using kind of CBD and THC, probably like a lot of people, kind of bundling.
Bring closer.
So, like kind of bouncing around and trying to find that balance of the kind of two major compounds that we understand in cannabis, THC and CBD. But what really interests me is kind of how far are we down the line as far as scientific research is concerned, isolating the different terpenes, flavonoids and other compounds that you pointed out as far as a holistic kind of approach, but individually how those affect you as far as creativity and whatnot. So if I were to come to source sativa, which I know is something that I need it, it's something that is very useful to me, but it's really difficult to find. So how far are we down the track to isolating those compounds, and where do you source them?
So it's a good question. You can source terpenes. Terpenes can be extracted and isolated, and they are, and they're used in the food industry and medical industry. You can buy 100% terpene oils. You can use essential oils which are high in particular terpenes as well to boost those particular terpenes that you're looking for. So lavender essential oil, full of linalool, copaiba, the thing we use in the clinic, my favourite terpene, 48% pure beta-caryophyllene. So you can essentially order terpenes. You can actually get a lot of the oils which will contain them over in the apothecary, probably here in Nimbin. In terms of isolating and whether that would be a good idea, I don't think that's probably the way to go for PTSD, and I think you would be better off selecting strains and medications which are high naturally in those type of terpenes, and you could also add them as essential oils orally as well, or inhaled. A big thing for PTSD, I think, really is a lot of CBD. So a lot of people will make the mistake of too much THC, and that can be destabilising to a PTSD patient. In PTSD, you've got anxiety, you've got hypervigilance, you've got your night terrors, emotional regulation. So CBD, I find, is really, really important to have a bit more than you probably think you should have of CBD, of a good quality one. And what you say about sativas is a very common comment I get from people with PTSD, yet I actually find clinically that sometimes that's not the best way. There's always a position for sativa-use medications, but because they are generally higher in terpenes like pinene and citrus-based ones, they're more energising and they can have more of an anxiety effect. So I would generally avoid sativas, especially in a cannabis-naive patient who's got PTSD. Of course, everyone responds differently, and it may work really well for you in that sense, but I would minimise sativa-based medication generally.
Thanks for the questions. I wasn't specifically talking about me. The question is more about how far down the line are we, as far as research is concerned, with these other compounds in conjunction with THC and CBD for specific medical, not just PTSD, but other.
Yeah, no, very. We're getting there. Definitely. There's a guy called. What the question was, how far down the line are we with isolation of terpenes and their effects medically and clinically, not just on PTSD, but on all sorts of diseases.
With cannabis.
Yeah, with cannabis. Yeah, so a fair way actually. There's a doctor named Dr. Russo in the States. He was one of the guys. He's one of the leading cannabis doctors currently, still RUSSO, and he done a lot of work on the entourage effect. And what you're talking about there is the entourage effect essentially. So that whole plant medicine and picking the right strains that contain the terpene profile that you want. So there's been a lot of work done on terpenes and their effect in isolation and effect with cannabinoids. So we use them all the time. And terpenes are the main basis of differentiation between your sativas and your indicas. So indica-based flower will have a lot more myrcene generally, which is found in mangoes as well, which is that body relaxation part. Generally have a lot more beta-caryophyllene. And your sativas will generally, as I said, have a lot more pinene, have a lot more citrus-based terpenes, so activation terpenes. Yeah.
Next question from this lady.
Yes, I was wondering, when you were talking about the spleen, and our natural cannabinoids, the anandamide and the AG2, whatever it was, thing. So does the spleen affect, not having a spleen, does that affect their production? And if not, where are they produced and what do you need to produce them?
Very good question. So the question was, will taking your spleen affect your production of natural cannabinoids, and where are those cannabinoids produced? And the answer to that is, cannabinoids are produced on demand where they're needed. So there are ways to boost your cannabinoid production naturally. Diet is a really important one. So having enough omega-3 oils in your body, so fish oils, hemp seed oil, flax seed oil, chia seeds, they're good sources of omega-3. And omega-3 levels generally in our world are lacking. We're very, very low generally in the Western world. So omega-3 is the good fat everyone tells us about. When we eat it, it goes into our bodies and it's stored in our bodies. And it's not stored just as fat, it's actually stored in the cell membranes of our bodies. So all of our cells are made up of fat on the outside and little water-soluble tails in the middle. That's every cell in our body. So when a cell is stimulated to produce endocannabinoids, and that could be any cell in our body, it takes a little bit of the fat out of those membranes and turns them into a cannabinoid, and then it puts it out into the synapse and it connects to the receptor. So having your spleen taken out, it's not going to affect your endocannabinoid production as a whole. It's definitely going to affect your immune response, because it doesn't matter how many cannabinoids you produce, you haven't got a spleen, so you can't fulfill those immune sort of functions. So it's a bit of a yes and no answer. So cannabis is produced where and when it's needed, and so are the receptors. So as I was mentioning, that's why it's site-specific. So you might have epilepsy, I might have osteoarthritis, we could take the same medication and both get a great result. And that's because when I take the medicine, it's focusing on where the cannabis receptors are, and that's around my knee. When you take your medicine, it's focusing on where your cannabinoid receptors are, that's around your brain. So other ways to boost your endocannabinoid system are really simple. A clean diet and lack of inflammatory chemicals. Omega-3 oils are very important. Looking at your gut health is very important, so probiotics are very important. And there's many different herbs and foods that will help boost your endocannabinoid system as well. Turmeric, I'm a big fan of turmeric. I've actually got a turmeric drink that we produce called Dr. Teh's Elixir, because turmeric has been shown to increase your natural endocannabinoid production. Black pepper, once again, echinacea, also some more off-centre herbs like ashwagandha. So there's a whole bunch of red clover. There's a whole bunch of compounds which will help you make more of your own endocannabinoids. And that's one of our strong focuses in the clinic, is just to make sure people are aware. It's not just taking your cannabis oil, but if you do a few other basic things in terms of diet and supplementation, you can boost that cannabis system as well. No worries.
I think that's the questions for now. There'll be more questions later on.
I think I'm a great believer in if the truth can be told, so it's understood, it'll be believed. And I think he does it really well. What do you think? I just want Dr. Jamie to talk now, and then we'll have some lunch. There's a great lunch out there. And then John will come back later and ask more questions and we can talk more generally. Yes. But also you'll be hanging around. He will be hanging around. You feel free if you want to talk to him. You'll get a quick free consult. Anyway.
Actually, Michael?
Yes.
I've just been asked to pause for a second. Apparently there's a whole lot of questions on the feed.
If people didn't hear me before and you need toilets, you go to the end of that little veranda and walk down a long ramp.
There's a whole lot of questions.
Whole lot of questions coming, because I really want to thank Christian and Maria, who are on the machines here, because they worked out how to live stream it through his mobile. So it's live streaming on the Hemp Embassy Facebook, and now Sister's got all these questions coming. Very difficult.
Well, if you want to hold them till later.
I don't mind. We do a few. You'll be quick.
Yeah.
Good on you. You're going to do questions now?
Just, you talking about the system?
Is it true that Western Australia has a set maximum dose of 60 milligrams of THC per day that can be prescribed for patients in the state?
I think, I'm not allowed to prescribe in Western Australia, so to prescribe in Western Australia you have to be in the state. So I'm not 100% familiar with their rules, but I am under the understanding that there is a limit to THC per day that can be prescribed without a supporting letter from another specialist like a neurologist or something like that.
I think we'll just do a quick answer.
Yep.
So the next one is how can we get it legalised so it can be more accessible to everyone?
It is legalised.
I'm a registered nurse working in HD, wondering about the role of medical cannabis for dementia.
Dementia is very useful. Cannabis is very useful for dementia, usually low dose. Often the patient can't communicate well and it's really about quality of life for the patient.